All right, so I go ahead and start by knocking on the door, introducing myself. Hi, I'm Cassidy. Then introduce myself to the mother. I'm a nursing student at the University of St. Francis, and I'm here to do a newborn assessment. And I go ahead and do my hand hygiene. That was hand sanitizer. But I would go ahead and start by doing the temperature, pulse, and respiration. So normal temperature for a baby is going to be 97.7 to 99.4. Normal respirations is going to be 110 to 160, and normal pulse. Normal respirations is going to be 40 to 60, and normal pulse is 110 to 160. Okay, so next I'll do the head assessment. I'll go ahead and measure the circumference of the head and check for the suture lines and the anterior and posterior fontanelle, as well as the a note for caput succedaneum, which is going to be a lump on the head that crosses suture lines, whereas a cephalohematoma is just going to be unilateral and doesn't cross that suture line. All right, and then next I'll go ahead and do the ears, checking that recoil on both. And then I'll go ahead and check the eyes, making sure that perla is present, as well as making sure there's no epicanthal folds and there's no bloodshot eyes. I'll go ahead and check the patency of the nares by covering each nostril, making sure there's breathing out of both. Go ahead and don gloves, check the mouth, note for that rooting and sucking reflex, as well as the front and back palate. I'll go ahead and look at the neck, make sure there's no lumps or masses. Go ahead and turning those. I'd go ahead and get my stethoscope out and listen to the heart and lungs. And I'd go ahead and take a brachioradial pulse. Doing that for a minute. And I'll go ahead and listen to the stomach as well while I have my stethoscope out. And then I'd go ahead and count the respirations by also listening and having a hand. Sorry, I think I'm gonna sneeze. Pardon me. Sorry, I keep sneezing. I have really bad allergies. But anyways, having the hand on the stomach to go ahead and do that. I check the umbilical cord, making sure that that's healing well. There's no crusting. If there is, go ahead and wiping that off with a warm cloth. Noting the dryness level of it, making sure it's outside the diaper for sanitary reasons. Making sure there's no redness, edema, swelling, and that it's well approximated. All right, and then next, I'll do the genital assessment. So with a male, you'd make sure that the urinary meatus is on the tip of the penis, noting the rugae amount on the scrotum. If there's a light amount, that could indicate a preterm baby. With checking the descension of the testes, you would put one finger in the inguinal canal and just making sure that they both have descended. Next, I'll check the height of the knees. Make sure that they are both the same height, and I'll check the feet while I'm down here as well. There's five toes on each, and I'm going to turn the baby this way so you can see, but I'd go ahead and do the Babinski reflex test, and that's just going up and around the foot and checking for fanning of the toes. During this whole assessment, I check the skin, check for any jaundice. I'll go ahead and do that by blanching the head, the chest, the stomach, the thigh, and then looking at the eyes to make sure there's no yellowing. I'll go ahead and check the skin turgor. I note any birthmarks, bruises, especially on the head from birth if there was forceps use, and any peeling, lanugo, anything like that. And then I'd go ahead and turn the baby over. Also checking the clavicles, making sure that they're both intact and not broken. So I'll go ahead and flip the baby over, and I'll go ahead and check that spine. And there's no fusion of this, or There's complete fusion of the spine. If there were not to be, you would note any dimples or tufts of hair, because that could indicate that. And then I just make sure everything looks okay on the back of the baby. If the baby was to have voided or to defecated, noting the appearance of those, and weighing the amount on the scale, minus the weight of the diaper. All right. So then I'll also looking on the back of the baby to make sure that everything is okay. With the skin, there might be a Mongolian mark right above the buttocks. That's normal in non-Caucasian babies. And that also noting while I was listening to the lungs, the signs of respiratory distress would include nasal flaring, grunting, fast and shallow breathing, blue hands and toes from lack of oxygenation or cyanosis. I think that's 3, 4 maybe, and maybe 5. I don't know. Sorry, I forget. But Tiger. Sorry, my dog's trying to play with me. But yeah. And with the fingers, just making sure that there's 5 of each, checking the arm reflex, make sure that it goes back to that flexed position, checking the hands, make sure the creases are even on the thighs too, and the feet. Lack of creases on feet could indicate a preterm baby as well. During this whole assessment, I'd note the behavior of the child, making any comments if it was overly agitated, if it was calm, happy, cooing, sleeping, anything along those lines. And that completes my assessment. Thank you.